Welcome to our deep dive into nutrition surveillance, a vital process for safeguarding public health. In this video, we'll explore what nutrition surveillance is, why it matters, and how it helps shape effective health policies. Whether you're a student, a health professional, or simply curious about how countries monitor nutrition trends, you'll find valuable insights here. Let's begin by understanding the core concepts and objectives that drive nutrition surveillance, and how it stands apart from traditional nutrition surveys. Our journey will take us through the steps, indicators, and real-world applications of this essential public health tool. Nutrition surveillance is more than just collecting data. It's a continuous, systematic process. It involves gathering, analyzing, interpreting, and sharing nutrition-related information. This ongoing cycle supports planning nutrition programs, monitoring trends, detecting problems early, and informing policy decisions. Unlike a one-time survey, surveillance is an ongoing commitment to understanding and improving population health. By keeping a finger on the pulse of nutrition trends, public health officials can respond quickly to emerging issues and allocate resources where they're needed most. It's important to distinguish between nutrition surveillance and nutrition surveys. Surveillance is continuous or periodic, designed to monitor trends and provide early warnings. It's action-oriented and typically less costly, using routine data collection. In contrast, nutrition surveys are one-time efforts that estimate the prevalence of nutrition issues, offering descriptive data but lacking the ongoing perspective. Understanding this difference helps clarify why surveillance is so valuable for timely interventions and policymaking. Nutrition surveillance plays a crucial role in public health. It helps detect emerging nutrition problems early, monitors the effectiveness of interventions, supports emergency preparedness, and guides the allocation of resources. By providing timely, actionable information, surveillance systems ensure that health programs can adapt quickly to changing needs and prevent crises before they escalate. The main objectives of nutrition surveillance are to describe the magnitude and distribution of malnutrition, identify vulnerable populations, monitor trends over time, provide early warnings of nutrition crises, evaluate nutrition and food security programs, and support evidence-based policy formulation. These goals ensure that surveillance systems are not just collecting data, but actively contributing to better health outcomes. There are several types of nutrition surveillance, each serving a unique purpose. Routine surveillance is integrated into health systems and uses regularly collected data. Sentinel surveillance focuses on selected sites to detect trends and early changes. Periodic surveillance involves repeated surveys at set intervals, while emergency nutrition surveillance is activated during crises. Together, these approaches provide a comprehensive picture of nutrition status across populations. Routine surveillance is the backbone of many nutrition monitoring systems. It's integrated into existing health structures and relies on data collected regularly, such as through Health Management Information Systems, HMIS. This approach ensures a steady flow of information, allowing for timely detection of trends and issues. For example, Ethiopia's HMIS nutrition indicators provide valuable insights into the country's nutrition landscape. Sentinel surveillance involves collecting data from selected sites, often chosen for their ability to represent broader trends. This method is less resource-intensive and is particularly useful for detecting early changes in nutrition status. By focusing on key locations, Sentinel surveillance can provide timely warnings without the need for nationwide data collection. Periodic surveillance relies on repeated surveys conducted at regular intervals. These surveys, such as the Ethiopian Demographic and Health Survey, EDHS, provide snapshots of nutrition status over time. By comparing results from different periods, public health officials can track progress, identify emerging issues, and evaluate the impact of interventions. During crises such as droughts or food shortages, emergency nutrition surveillance becomes critical. This type of surveillance is rapidly deployed to assess the immediate nutrition situation and guide urgent interventions. By providing real-time data, emergency surveillance helps prevent malnutrition from escalating into widespread health emergencies. The first step in conducting nutrition surveillance is to clearly define the objectives. What specific nutrition problem needs to be monitored? Which population groups are most at risk? Setting clear goals ensures that the surveillance system is focused and effective, targeting the areas where it can make the greatest impact. Next, it's essential to select the right indicators. These may include anthropometric measures like height and weight, dietary indicators, and health or environmental factors. Choosing appropriate indicators ensures that the data collected will be relevant and actionable, providing a solid foundation for analysis and decision-making. Data collection is at the heart of nutrition surveillance. Using standardized tools and trained personnel ensures that the information gathered is accurate and reliable. Whether through health facilities, community screenings, or household surveys, consistent data collection practices are key to building a trustworthy surveillance system. Once data is collected, it must be carefully analyzed. This involves calculating prevalence rates, identifying trends, and mapping geographic distribution. Effective analysis transforms raw data into meaningful insights, revealing patterns that can guide interventions and policy decisions. Interpreting the data is crucial for understanding the context behind the numbers. Factors like seasonal variation, program coverage, and local conditions can all influence nutrition outcomes. By considering these elements, public health teams can make informed decisions and tailor interventions to specific needs. The final step is to disseminate findings and put them to use. Reports, policy briefs, and program adjustments ensure that the insights gained from surveillance lead to real-world improvements. Data should never just sit on a shelf. It must inform action and drive positive change. Anthropometric indicators are key measures in nutrition surveillance. They include wasting, acute malnutrition, stunting, chronic malnutrition, underweight, a composite measure, and BMI for adults. These indicators provide a clear picture of the nutrition status of different population groups and help identify areas needing urgent attention. Micronutrient indicators focus on specific nutrients essential for health. These include hemoglobin levels for iron, serum retinol for vitamin A, and urinary iodine concentration. Monitoring these indicators helps detect deficiencies that can have serious health consequences, especially for vulnerable populations. Dietary indicators assess the quality and diversity of diets. Key measures include minimum dietary diversity and the food consumption score. These indicators help determine whether populations are getting the nutrients they need for healthy growth and development. Health and environmental indicators provide context for nutrition outcomes. These include disease incidence, access to water and sanitation, and market food prices. By monitoring these factors, surveillance systems can better understand the root causes of nutrition problems and design more effective interventions. Nutrition surveillance draws on a variety of data sources. Health system data, such as HMIS or DHES2, growth monitoring, and household surveys like the EDHS, provide valuable information. Community-based sources, including health extension workers and community screenings, add local insights. Early warning systems also use rainfall data, crop yields, and market prices to anticipate nutrition crises. Early warning systems are essential for preventing nutrition crises. Key indicators include rising rates of wasting, increased food prices, reduced dietary diversity, more frequent disease outbreaks, and population displacement. Monitoring these signs allows for timely interventions that can save lives and resources. The importance of early warning in nutrition surveillance cannot be overstated. By detecting problems before they escalate, early warning systems enable timely interventions, prevent deterioration into famine, and ultimately save lives and resources. This proactive approach is a cornerstone of effective public health practice. Ethiopia has developed robust nutrition surveillance systems, including the National Nutrition Surveillance System, HMIS nutrition indicators, and the EDHS. During emergencies like droughts, special surveillance efforts are activated to monitor and respond to acute nutrition needs. These systems provide a model for integrating surveillance into national health strategies. Ethiopia's nutrition surveillance system has several strengths. It's well integrated with the health system, collects data at the community level, and has strong experience with early warning. These features ensure that the system is responsive and capable of addressing nutrition challenges as they arise. Despite its strengths, Ethiopia's nutrition surveillance system faces challenges. Issues include data quality, timeliness, limited micronutrient data, and weak data utilization. Addressing these challenges is essential for ensuring that surveillance data leads to effective action and improved health outcomes. To sum up, nutrition surveillance is essential for timely action in public health. It differs from one-time surveys by providing ongoing, actionable information. Carefully selected indicators and early warning systems are critical for saving lives. Most importantly, data must be used, not just collected, to drive meaningful change. For those interested in learning more, key resources include the Ethiopian PHEM Guideline 2022, WHO Nutrition Surveillance Guidelines, FAO Early Warning Systems Manuals, and Ethiopian National Nutrition Surveillance Reports. These materials offer in-depth guidance and practical examples for implementing effective nutrition surveillance. Thank you for joining us on this exploration of nutrition surveillance. We hope you now have a clearer understanding of its importance, processes, and impact. Remember, effective nutrition surveillance is a cornerstone of healthy communities and a brighter future for all.